Ready? Okay. Dr. Travis Kendall here from Texas Sedation Dental and Implant Center. And this is another special patient. And David and his wife, she's not too happy about being on camera here. So forgive her. But she's got a great attitude and we appreciate you coming in. I know you're not happy about it. But this is a fantastic option. A lot of our smile reveals are 5 months later after surgery. David is one of the ones that just had surgery yesterday and doesn't have a lot of bruising. I'm going to say yet because there may be some bruising still. But it's important for us to capture kind of that next day with the people who are willing to do that with us. This is a process. What I'll tell you guys is a lot of times the second day may be worse when it comes to pain. Usually first day is pretty good. Second, third might be a little bit more painful. And then it should start getting better. Okay, most people. Now some people, they are great and they hardly ever feel pain. So there's a big variety in that. What would you say your pain level is right now?
I'd say just mid-range.
So like
Nothing.
4, 5?
Yeah, 4 or 5.
Out of 10?
Easy.
Okay. What was it last night? Was it more painful last night?
No, it really hasn't
Kinda
been
stayed
as
there.
bad as I thought it was going to be.
And
to be
are
honest.
you staying on the pain management protocol every
Yes.
6 hours?
Yes.
Okay. That's another key that I find for people. If they stay consistent, even in the middle of the night, waking up, taking the recommended dosages, it never hits. The people that have the most pain, they're like, oh, I'm doing fine, no pain. They let it lapse, then the pain hits, and then it takes a while to get it back under control.
Under control again.
Yeah. So good job making sure that you maintain that.
So
So
let me ask you something. Are you still wanting to go to academy after this?
Yeah.
See,
yeah, he's
one
feeling
shot.
good. Good.
Well, I got to get mouthpiece, because I told
Yeah.
her I grind my
Night
teeth
guard,
a bit.
yes.
And yeah.
So tell us what brought you in to see us here.
She did, actually.
See how important it is to have you
So
here?
it's no, she had well, we had talked about it and everything, and she had checked around as to where to go and kind of
We did a lot of
research.
research.
And what was it that you saw about us that made you say, oh, we're going to give this place a try?
I think it was two-part. It was your Texas Sedation Dental. I liked that.
Yeah.
That told me right away that y'all knew what y'all were doing. And then I watched a video, and so you were the first ones we came to.
Yeah.
And then we went to like 5 other places.
Yeah.
And we just decided, that y'all were the same price as everybody. You had more experience, and I just had a really good feeling about it.
Good. Awesome. So did you go to all places here in East Texas, or did you go to Dallas, or?
No, we met Tyler, Nacogdoches, Jacksonville, and Rusk,
Okay.
where we live.
Perfect. My guess is a lot of those people just kind of did it on the side, or they didn't do it all the time like I
Right,
do,
yeah.
right?
Right.
And did any of them have the digital processes? Did they talk about their process at all?
Basically, just one place,
The
and they
one
were more
Nacogdoches.
into reconstructing heads and using bones to
Gotcha.
do, and then the dental was. I felt comfortable that they could do it, but it was more of a sideline to them. They like doing the big stuff better.
Yeah. Well, great. Well, I love that because you did your research, and that's what I tell people. Go meet other dentists, talk to them, find out about their process, because there is a big difference. When I started doing this 13 years ago, and for, 10 years of that, I did it the way most people do it, which is dentures. We retrofit dentures the next day, or that same day. But the process you're going through is our new digital 24 teeth in 24-hour day, where during surgery we're able to capture all the data. We're able to do top and bottom all in one day, and then you come back the next day. How was your experience today getting teeth day after surgery?
Excellent. I mean, it's unreal, for me. I mean, it's just
Pretty crazy in one
it
day,
is.
right?
I mean,
And that's, as dentists, we like to save teeth, and that's our primary focus is saving teeth. I remember meeting some dentists that did predominantly what I did, and I just thought, man, they're taking out way too many teeth. Now that I'm in that role where people seek me out because this is what I do, I realize that so many people, they've already been there and done that. They've done their crowns, the root canals, they've got the gum disease, they've had the deep cleanings, and people just get to a breaking point where they don't want to keep spending money and after money after money with the eventual same result of ending up in implants or something.
Still being miserable.
And painful, yeah.
I mean, because every time, I mean, I get one procedure done, another, and I'm still, as you get home and start to eat again, there's another problem.
It's like a non-stop.
Here the problem is you don't want to spend the money. And I will say I was kind of shocked when we first started,
yeah.
and at the cost of it and everything. But the cost is the same for all the good places I went to.
Yeah.
It's the same cost.
Yeah.
It's just who you feel comfortable with. And I felt very comfortable with y'all. He let me make all the decisions. I just jog him along.
Yes.
Pretty much. Yeah.
That's the way a wife is.
That's the way that they should be. They got to take care of us, otherwise we'd ignore ourselves.
Yeah, I mean,
So, but what shifted? Because she said in the past you didn't want to spend money on dentistry. So that tells me they told you needed deep cleanings, and maybe you're just like, I'm not going to spend.
No,
money on that.
I've done deep cleanings and everything of the sort, just just eating one night, and then one tooth, I mean, I just bit down wrong, and it was loose, and then all my teeth just kind of started to get loose.
And also, Dr. Gino said that you weren't a candidate for any of this.
Yeah.
So one of them said you weren't even a candidate for it.
So you really had to live with it.
Yeah. So that's what we find with a lot of people. And like I told you, your surgery was more difficult. Now that a lot of people are seeking me out, I am getting a lot of people that have been told over and over again by different dentists that they're not a candidate. And that's a couple of things. Some of them don't even have the 3D technology.
Right.
And they just assume because you've lost a bunch of bone that you're not a candidate. The other thing is a lot of them just don't have as many tools in their bags that I have. A couple years ago, I went to Brazil and Colombia and got trained in zygomatic implants and all these advanced surgeries. I'm actually going to a course in Arizona in the beginning of December with a couple assistants, learning different techniques, going through and anchoring into the nose and like going through. Fortunately for you, we didn't have to use a lot of those techniques. I did use a technique I learned a couple years ago, which is called the pterygoid implants, which is way far in the back on the top,
Right.
Because your bone from here to here was a little minimal, so I wanted a little bit more anchorage on the top.
Yeah, we had talked about 4 top, 4 bottom, and I knows
6.
at the end had 6. So
So that's all based on surgery, and that's the difficult thing with people who don't do this a lot, is a lot of times they don't know what they don't know, and they get in there and there's just not as much bone, and then they're giving you something that's not going to last long term because there's not enough anchorage. Might last a few years, but eventually it's going to potentially fail, which is why all these advanced techniques where I get more anchorage to support it is a really good thing. Now the key that I love about this process is in the future, because we have the digital methods, the difference between the analog and the digital pictures. Now that we have this digital rendition of your teeth, we can 3D print another set within an hour. So if these break or have issues, long term, let's say 10 years down the road, you have a problem with an implant and we have to take it out, and that can happen. Just like anything in life, you could have a complication. It's very rare, but if that happens, we can take your same set of teeth that we finalize and put the new position of the implant in and give you the same set of teeth that you had before.
Yeah.
Whereas historically, it was like having to take a new picture and all the steps, and it's very expensive to go back and redo a new device. Whereas moving forward, if there was a problem 10 years down the road, we'll have those digital files that we can just go straight back to where we need to go.
Oh,
so it's pretty cool.
Technology nowadays.
Well, that's one of the things that I think I don't know, I thought that he would get his teeth pulled and then he wouldn't have any teeth for 3 or 4 months. So
Yeah.
that held us back for a long time.
Yeah.
And then I thought, okay, he's going to get his teeth pulled and he's going to have regular dentures
Yeah.
for 3 or 4 months, which, you know, is going to fall out when he laughs or something like that, or he's going to take them out.
And you know, he would take them out and play with you. And
Yeah, and look at me with, you know, men. So, then when I found out he's actually the next day gets real, you know,
Yeah.
teeth that aren't going to come out, it was wonderful. It was
Yeah.
wonderful. Of course, I haven't seen him yet.
I know. You guys are ready, aren't you? Okay. Well, let's go ahead and get...
She might be.
Go ahead. I want you to show her first. So go ahead and take it off and give her a big smile.
Oh, man, those are pretty.
Are they shiny?
Take a
Oh,
look.
they're not like Friends shiny where he did his teeth
Yeah.
and they turned the lights off and they
Oh, yeah.
glowed, you know.
Oh,
You
we
look
don't
like
have those.
Ross, no.
I can't put like a little blue light in and shine
No,
through.
they
Take a
look
look.
Good.
Oh yeah.
Those look nice, don't
I
they?
think the swelling will go down.
He's
too.
quite
Yeah.
swollen
Yeah, swollen.
now because we just did surgery yesterday.
Mhm.
But go ahead and zoom in on that. Smile. Very natural looking. They look very natural.
Good.
So,
I'm happy.
Yes.
I've never had teeth that looked like that before.
No.
You really haven't.
No, I haven't.
I think his mother had taken tetracycline when she
Oh,
was
so they
pregnant.
were dark,
So they
yeah.
were almost looked rotten all the time.
Yeah.
Yeah, and Dad had, well, and Dad's his teeth were never real good either.
Yeah.
You know, so and it's probably about this time in his life that he had to
Got a
have false
denture.
teeth.
People didn't understand.
Yeah.
And they think, well, what's he doing with all these rotten teeth in his mouth? But they weren't
They
rotten.
weren't rotten. Yeah. Sometimes the
discolored.
ones that look really bad.
They were really discolored a lot.
Sometimes they're even stronger. If it's fluorosis or it's high fluoride content, sometimes they're even stronger. But yeah, so there's the key about this. I think they look fantastic. Yes, you are swollen, and there's all kinds of changes we can make. We can bring them out further. We can change midline. But smile for me. We're pretty darn close. I think the
Yeah.
midline might need to go a little bit to your left, but these are all easy changes. Instead of having to take them off and send them to the lab and try to make a change, it's a virtual program. Just move them over a little bit, reprint them. So it's a pretty amazing process. And then we get another set that you get to try in. So basically, we'll make sure to have a set in your mouth that you both love, and you'll be able to try them out, make sure they feel good. We'll make sure the vertical dimension is the right distance that you can chew and talk and all this stuff. Now, initially, I mean, you're already talking really well for having just put them in. I'm really not hearing much change, just a little bit.
Yeah.
But if you practice reading out loud, talking in the car with your wife.
Well, I don't talk much. Most of the time, I'm pretty well quiet.
So, but if you just read out loud to yourself, that will, if you come to a word that, you know, you lisp a little bit, your tongue will get you used to this new position of
Yeah.
the teeth and everything. But we have a lot of changes we can make to dial it in once everything heals, and
Feels pretty natural, really.
feels pretty good. Huh?
Corn on the
surprised.
cob, baby.
Okay, but that is, remember,
Later.
Exactly. Give me 4 to 5 months of soft foods,
Yes, I know.
and then we will free you up to eat anything you want.
Soups and stuff. No
Yeah.
cooking. No cooking. I don't have to cook anymore.
Yeah.
No, I'm kidding.
So anyway, thank you so much. I know you didn't want to do that.
Didn't.
But honestly, this guy's a little dry. You were the highlight of the reel. Just
He
kidding.
looks so good though.
It looks great, right? So,
You better not
So
go
you're
out
not-
looking for
You're not
young
going to kick
ladies,
me out of the house anymore.
because you'll have a heart attack and I'll get all the money then.
yes.
No, there you go.
Anyway, we appreciate you guys sharing your story. I know you don't like that, but it really
You
was
can edit
better.
very well. Okay.
It was better having you in it.
Just have my
And
voice and I'm.
I would tell you, we only live once, so start taking pictures of yourself. People want to see you, even though you don't want to see you. Don't be afraid to let people see you. So
I got pictures of her.
yes.
There's a few good ones, not many.
Anyway, thank you so much for tuning in, all 10 of you. No, I'm just kidding. But we appreciate it. We're here to take care of people. That's what we tell people. Not everybody, you know, you mentioned it, this is not cheap to get a
No,
new set of
no.
teeth. This is a very costly thing. This is not something the government pays for. This is not something insurance pays for. They pay a small portion, but this is something that you come out of pocket for. But it is life-changing. You know, when you can eat what you want to eat, you don't have to have dentures. All the things that were holding you back are the keys to this. It gives you your life back. Where you can eat what you want to eat when you want to eat it without having to worry about gluing teeth in or snapping teeth in or taking them out at night. It truly is life-changing, and it's
definitely
transformation.
A buzzkill in the bedroom when you have to put your teeth
Take out, yeah.
glass. Well, it's more life-changing than going out and buying a brand new car.
Yeah.
You know, drive the clunker for a while and get some good teeth.
And we did an interview 2 days ago with the lady. She had dentures for 12 years before we did it. Mm-hmm. And initially we just did the lower. Yeah, we did the lower, and she was just going to stay with the denture on the top. But once she realized how nice that was, she came back and upgraded and did everything. But what she said is you don't realize when your teeth are out at home, you have dentures and your teeth are out at home, and someone rings the doorbell, you're running back, gluing your teeth in before you can go open the door because you don't want people to see you without your teeth. These are things that people don't think about. Dentures are not teeth. They're big pieces of plastic.
Well, and you don't want to roll over and look at your husband's teeth in a glass in the morning. I mean, it's not
doesn't turn you on, does it?
No, it does not.
Anyway, thank you for sharing your story. We appreciate it. It's invaluable. There's so many people out there like you that, you know, they don't know what it costs. They don't know what their options are. They don't know you can get them within 24 hours and that they're fixed in place and they don't come in or out. So thank you for sharing your story.
And
Thank you.
You know, you wouldn't pick the cheapest heart surgeon either, would you? No.
I wouldn't.
You know, you need to research and find out who has the experience. And
I commend you for that. Yeah. I do. I commend you for that.
I don't do it very often.
But with healthcare, you got to be careful because you just don't know. There's a show called Dr. Death where they talk about this doctor in Dallas that was killing people left and right. But it's one of those things where you need to look into. You need to do your research. You need to talk to people. So I commend you for checking around.
Thank you.
Yeah.
Thank you so much. Congratulations. Thank you.
I'm so excited. I'll even go to Academy with you.
You're going to have to now.